This little pill is metformin. It's the most common medication taken for diabetes worldwide. Over 200 million people take this medication. And today, I'm going to tell you 5 hidden benefits of metformin. This is mine, by the way. Are you trying to guess what the hidden benefits are? Well, it's not about reversing the aging process, and it's not about weight loss. I know that some of you are concerned about metformin, stressing the mitochondria. Some studies have suggested that it can cause problems in people when they're exercising, decreased exercise function. We'll cover that later on in this video. But before you say, oh boy, here's Dr. Brewer pushing another pill, consider this. There is no drug, no supplement, or remedy that beats lifestyle for cardiovascular prevention. Now, having said that, there are times and situations when medications, supplements, and other remedies can help. So get comfortable on your couch or bed. Well, no, don't do that. Even better, get on that treadmill or do some resistance training and plug this into your ears, and let's get started. Hidden benefit number 1. Did you know that metformin reduces what we call cardiovascular death risk? I'm talking about the risk of suffering, even dying, from heart attacks or strokes. A meta-analysis, which is a study of studies, involved 35 clinical trials and over 15,000 participants, and found that metformin was not only safe, but it reduced the risk of cardiovascular events, heart attacks and strokes, by up to 21% when compared to placebo. The effect is actually better in the younger people when they used metformin as the only medication that they took. So for situations like this, especially with a young person considering medications, it's obviously better to start thinking about lifestyle. Make sure you're doing lifestyle first, then talk about medications. And younger in this case is not 15 or 20. It's more like in the 50s, even 40s. At that point, yes, let's talk about metformin. But you should be aware that when metformin is combined with specific drugs called sulfonylureas, it can actually increase the risk of death by 40%. So let me explain this. The common names for sulfonylureas are glimepiride, glipizide, and in developing countries, glibenclamide, among others. What they do is stimulate the production of insulin by the pancreas. The more insulin you produce, the less glucose is in your bloodstream. The problem is, a significant and common side effect of the sulfonylureas is hypoglycemia. That is, low levels of blood sugar. Now, that can be a major problem because significant episodes of hypoglycemia or low blood sugar, especially below 55, have been associated with an increased risk of cardiac events, heart attacks, and death. That's why I just never prescribe sulfonylureas. Metformin, on the other hand, works differently. It decreases the amount of glucose that the liver produces. That's the major mechanism for lowering glucose. There are other mechanisms that we'll discuss later in the video. Are you aware that diabetes is the number 1 leading cause of kidney disease and kidney failure? Another meta-analysis showed that metformin may decrease the risk of cardiovascular death in people with kidney disease by 24%. And to back this up, in yet another study, metformin was found to decrease the risk of cardiovascular death in people with diabetes by up to 25%. So now you see how there is a consistent evidence on metformin reducing risk of death by heart attacks in young people, people with kidney disease, and others with diabetes. Let's look at hidden benefit number 2. Metformin can help treat different types of cancer. There is evidence that shows that metformin can increase the chances of survival in head and neck cancer, kidney tumors, colon, prostate, stomach, pancreas, and lung cancer. No, I'm not saying that metformin cures cancer. It does seem to have helpful effects, though. And why does metformin help? Well, get ready. This is going to be a little bit geeky, and it actually has a lot to do with many of the other hidden benefits of metformin. So here's how this works. Metformin promotes a signaling pathway called AMPK. First of all, what's a signaling pathway? It's a series of chemical reactions working to control a specific function in the body. AMPK stands for adenosine monophosphate protein kinase. That's a mouthful. What is it? Well, let's stop and analyze some of this. Protein. What's a protein? It's a molecular structure formed by small pieces called amino acids. Some popular amino acids are glutamine, lysine, arginine. These amino acids connect to each other, and then that forms a protein. Proteins are the structural component of the body. They help create cell walls and muscle cells, among other things. But even more important than that, proteins are the major problem solvers of the body. When you see the word kinase, it means that it's a protein with a specific metabolic function, and it can help substances transform or be transported. We call that an enzyme. So the enzymes are the proteins that are the major problem solvers. So AMP kinase is an enzyme. What does this enzyme do? It works as the cell's fuel gauge. It knows the difference between full and empty, and places in between. It helps the cells create more mitochondria to burn glucose and produce more energy, ATP. Remember your high school biology classes? ATP's that energy currency of the cell, and AMPK helps with that, and it can also regulate cell growth. Impaired AMPK function has been associated with abnormal cell formation, growth, and guess what? The definition of cancer is unbridled, abnormal cell formation and growth. Metformin helps regulate AMPK and therefore helps regulate the use of glucose in the cell as an energy and cell growth stimulator. Therefore, it helps in cancer prevention and in treatment. So, that was a lot. That's the major part of the geeky stuff. Thanks for hanging in there. Let's get to hidden benefit number 3. Metformin is a great option for treating PCOS, or polycystic ovarian syndrome. PCOS is fairly common. It impacts up to 15% of women during their childbearing period, or ages. PCOS is a hormonal disease. It's characterized by many small sacs of fluid developing in the ovaries. Those sacs are called cysts. Over time, women with PCOS have increased androgen levels, that is, male hormone levels, like testosterone. This results in the production of fewer eggs in the ovaries, which leads to infertility. Additionally, these increased testosterone levels also been associated with excess insulin. We'll often see it, for example, women with PCOS tend to have a little bit of a light mustache sometimes. That's one of the signs. Additionally, increased testosterone levels have been associated with excess insulin. Excess insulin leads to obesity, diabetes, and cardiovascular disease. Research has shown that metformin can help people with PCOS, help these women lose weight and improve their hormones. Another meta-analysis shows that when combined with lifestyle, metformin can also improve glucose levels, insulin resistance, and pregnancy success in women with PCOS. So I told you we were going to get geeky a couple more times, but not very long like we did the first time. Why does metformin improve insulin sensitivity? Well, first of all, what's insulin sensitivity? Insulin sensitivity is our body's ability to take sugar out of the blood, where it causes inflammation, and into the cell where it can be used as fuel. Just like we saw before with AMPK, metformin can improve other signaling pathways that will end up making it easier for your body to metabolize and use glucose as energy. And this is just one more of the many mechanisms of metformin. Now, this can be hard to even notice. A lot of people will say, I've been taking metformin for years. I didn't feel a thing. And some will say, look, I tried it. It didn't lower my blood sugar levels. So why take it? If you're one of these people, I can tell you, metformin impact can seem subtle, but it goes beyond just lowering blood sugar level. It will improve your metabolism, especially if you're making the necessary lifestyle changes. But it takes time. Here is hidden benefit number 4. Metformin can reduce the growth and complications of AAA, abdominal aortic aneurysm. An aneurysm occurs when part of the artery wall weakens, and then abnormally it balloons out. If the balloon ruptures, it can cause massive bleeding. Why massive? Because the aorta is the biggest artery, and it transports about 5 or 6 liters or quarts every minute. That's about the amount of blood that you have in your whole body. So a rupture of an abdominal aortic aneurysm can obviously be catastrophic. People can bleed out from that. A fairly recent meta-analysis shows that people with aortic aneurysm can see a reduction in the size of the aneurysm when taking metformin. Decrease of about a little bit less than a millimeter, 0.9 millimeters per year. Now, that doesn't seem like a lot, but it is. Metformin was also associated with a reduction of events, that is, ruptures, a reduction of about 40%. So let me repeat. Metformin was associated with a 40% reduction in events. But how can this medication do that? Remember we said that we were going to refer back to AMPK a few times? It turns out that it also plays a role in cardiovascular inflammation. In layman's terms, cardiovascular inflammation is a way to say that your arteries are on fire, and that includes the aorta. There's inflammation or irritation of the lining of the artery wall. AMPK dysfunction is associated with damage to that inner layer of the artery wall and the other layers as well, increasing the risk of aneurysm and rupture. That's why diabetes, prediabetes, and insulin resistance are major risk factors for aortic aneurysm. They all increase cardiovascular inflammation. Before we go to the last hidden item, let's talk about mitochondrial stress. A recent paper shows that metformin might reduce VO2 max, even up to half, in people when they're exercising. VO2 max is a score used to measure how effectively you use oxygen when exercising. And guess which part of your cell uses that oxygen? Yep, you guessed it, the mitochondria. Now, based on that study, you're going to find a lot of people saying, oh my gosh, I don't take metformin anymore. It ruins my ability to exercise, and therefore the exercise is not as helpful to me from a health perspective. I might agree somewhat in terms of it reducing your ability to exercise, but I'm not convinced that it reduces the effectiveness of your exercise. Where have you seen that? There's no evidence indicating that. It's thought that because it stresses the mitochondria, not allowing them to use oxygen efficiently, that it's negatively impacting your health. Let me remind you what we're talking about with these hidden impacts of metformin is a decrease in some components of the cellular metabolism. Let me also remind you that cancer is cellular metabolism gone totally unbridled, gone wild, creating too much growth of a cell and too much growth of multiple other cells. So, I'm wondering if our metabolism does need to be a little bit throttled back. Anyhow, here's the bigger issue that I have. These were higher dosages, 2 grams and higher. I never used that. Also, I'm not an athletic or Olympic level professional athlete. I'm comfortable with the ability to do the hill sprints that I do, the resistance training that I do, and the rehit, as you see in the B-roll here. I'm not worried about athletics for me and mitochondria. With metformin, I'm 67 years old. I'm doing well. Finally, we have hidden benefit number 5. Metformin prevents diabetes. We're talking about prevention here, not treatment. That might not seem as shocking as it sounds, but what we're saying is that you don't need to have full diabetes to try metformin. You might have several other experts take or have taken metformin preventively in the past. You've seen that on the internet. Some have stopped because of, quote, mitochondrial toxicity. But the results of the meta-analysis involving 31 trials found that metformin can decrease the new onset of diabetes by up to 40%. That's because in people with a risk of diabetes, it decreases blood glucose, decreases insulin levels, it decreases triglycerides, and if you're worried about it, it decreases LDL cholesterol too, that cholesterol that people like to call bad cholesterol. It can also help increase HDL cholesterol, the quote, good cholesterol. Now here's one of the key concepts and questions here. Who is at risk for diabetes? In the meta-analysis we discussed, the focus was on people with obesity, a family history of diabetes, lack of exercise, insulin resistance, high blood pressure, high cholesterol and high triglycerides, vascular disease, PCOS. But consider this. If you're thinking, well, that's not me, I don't have any of the things that he just listed. The NHANES study, it's an analysis of the U.S. Census. It shows that in the U.S. alone, 52% of adults 18 years and older have prediabetes. If you're talking 60 and older, that goes up to 85%. And the worst part is 90% of us that have it don't even know it. Add to that the consideration that 2/3 of Americans are overweight or even obese. Then you begin to see most of us are at risk for diabetes. So don't be someone who doesn't know. The most common reaction to this kind of information is the worst one. It's called denial. That's not going to happen to me. That's denial. Unfortunately, in our medical world today, another form of denial is saying, if I had this problem, my doctor would have told me. Doctors, even in the U.S., 3/4 of primary care doctors don't know how to diagnose prediabetes. So get the proper testing. Don't depend on your doctor. We talk about that kind of testing in this channel. Let us know if you'd like to have an exclusive video about insulin resistance, prediabetes, and diabetes diagnosis. To me, insulin resistance, prediabetes, and diabetes is the same problem, and metformin has shown benefit with all of them. So just remember, you cannot out-prescribe, out-supplement, or out-metformin a lifestyle problem. Let's round out this discussion. Let's talk about side effects for metformin for just a minute. Although metformin is safe, there are a couple of side effects to discuss. The most common one is diarrhea or gas. It can be uncomfortable. I've never seen it to be dangerous, and it's almost always gone within 1, especially within 2 weeks. The truth is that about 1% of people will still not be able to tolerate metformin, even after a couple of weeks of trying. That group, there is a genetic predisposition for this. Again, it's unusual. You see it in about 1% of people. And for that 1%, I suggest either not taking it, taking a very low dose of metformin, or trying something else if you really have a need for medication beyond lifestyle. One thing we didn't mention is that there's evidence that metformin can improve the gut biome, and that diarrhea might just be a sign of that process, improving the gut biome. There's also evidence that suggests that people with metabolic disease, that is, insulin resistance, prediabetes, and diabetes, have gut biome issues. The nausea, vomiting, constipation, abdominal distension, all of these are basically related to the same issue. Another side effect that you might hear is that metformin decreases vitamin B12. That's an unusual side effect. When it happens, it's usually associated with inflammation of the gut, and it's usually in older people in their 80s and beyond. Be skeptical of that side effect. It's hard to track B12 because B12 blood measurements are just not reliable. Liver issues can happen as well, but are extremely rare and are usually related to interaction with other medications, supplements, or herbal remedies. Another side effect that you will also hear about is lactic acidosis. Now, lactic acidosis is an alteration of acid balance, the pH balance. The production of lactic acid, when it does happen, can be dangerous, even life-threatening. Now, that's significant lactic acidosis. This theory that metformin causes lactic acidosis has been pretty much debunked. Overall, metformin is safe. Starting at low doses and increasing it gradually is the best way to minimize side effects. But I'll still recommend discussing it with a medical provider to get the right dose for you. We rarely recommend the highest dose, the standard dose, which is 2 grams a day. I personally take 500 milligrams 3 to 6 times in a full week. But as I always say, lifestyle is king. There are no doses of metformin that can replace lifestyle. So there you have it, the 5 hidden benefits of metformin. These did go beyond just treating diabetes. But speaking of diabetes, did you know that erectile dysfunction, or ED, is one of those hidden signs of diabetes? Cialis is one of those medications that's famous for its effects on ED. But it also has some hidden benefits that I believe you probably don't know about. Check them out in this video right here.